Good evening, America, and good afternoon, Australia. You're back listening to Radio Toni, and this is the Everyday Business Show, and I'm your host, Toni Lontis. Thank you for listening to us live today. We're live streaming across Facebook, YouTube, LinkedIn, and Twitch, and waiting online to hear your comments, questions, and to provide you with links to anything that we talk about today is the wonderful Peo, all the way from the Philippines. He will have your links ready to you if you pop them in the chat box while we're live to air. Just a reminder, if you want to find out more, you're traveling while you're listening to this, jump onto radiotoni.com. You'll find all of Dr. Parnell's information, links to all his amazing products right there. You can also go to parnellpharmaceuticals.com. Remember, the replays of these live shows are on Binge TV across the US and available on the Toni TV app on all LG, Roku, and Samsung smart TVs across the world. So tonight we have an amazing guest, and it's a real privilege to talk to a clinician tonight. But before I introduce you to Dr. Parnell, I want to let you know all about what he stands for. As an ex-theatre nurse or perioperative nurse, I spent many, many years working with wonderful ENT, ear, nose and throat surgeons in a clinical capacity, and it's a wonderful opportunity for me to go back to my roots and talk to someone from the health fraternity. Now, Dr. Francis Parnell is CEO of Parnell Pharmaceuticals, a California-based private pharmaceutical company founded in 1986. The company develops, manufactures, and markets prescription and over-the-counter drug products that maintain and restore mucosal skin integrity. The products are natural-based and patented for oral and nasal care and personal use. Dr. Parnell co-founded Parnell Pharmaceuticals and Y.S. Laboratories over 30 years ago to research and create pharmaceuticals to sustain wellness and improve the quality of life. A graduate of Georgetown University School of Medicine, Dr. Parnell completed residency training in the University of Wisconsin at Madison. Dr. Parnell is a practicing Otolaryngology-Head, Neck, and ENT surgeon and has done that for over 30 years. He is a fellow of the American Academy of Otolaryngology-Head and Neck Surgery and the American College of Surgeons. He is a co-founder of the Cosmetic Laser Surgery Institute with his wife, Dr. Diana Parnell, and previously was a corporate medical director at Becton, Dickinson Co. His varied career includes service as a lieutenant colonel in the US Army, an assistant clinical professor at the School of Medicine, University of California in San Francisco, and a delegate to the World Health Organization. He has published and presented a number of scientific papers and has lectured on contemporary topics and healthcare on many levels. Dr. Parnell is the first company dedicated to the research and development of new and innovative products that restore and maintain mucosal integrity. Employing a proprietary and patented technology, Parnell Pharmaceuticals products contain jojoba santa, which contains natural antioxidants, mucopolysaccharides, and glycoproteins. Parnell Pharmaceuticals is a closely held private pharmaceutical company, and its headquarters are in San Rafael, California, with an office in Dublin, Ireland. The company is all about things mucosal and skin integrity, and the products are natural-based, and they are personal care and anti-infected use, which we're going to talk about with Dr. Parnell today. The products are distributed across North America and Europe. Welcome to Radio Toni, Dr. Parnell. How are you this evening?
Thank you for having me. Appreciate it.
We are looking forward to talking to you tonight. Now, I'm guessing that it was quite a major decision when you decided to start a pharmaceutical company. Was there something that triggered that desire to have and start a pharmaceutical company?
And what happened was that after about 4 or 5 years, his corporate medical director at Becton Dickinson, which at that time
Uh-huh.
was about a billion-dollar company. They make insulin syringes, ace bandages,
Yes.
many other things, scalpel blades, etc. Anyway, after doing
All the
that,
good stuff.
good things, suction catheters. And anyway,
Yes.
my wife and I came back to California to practice, and we went into practice together and found out that we were not getting uh, products available that our patients needed, particularly in the areas of skin care and oral and
Mm,
nasal care. And so I had been taking care of a lot of patients with head and neck cancer post irradiation who would have severe
yes.
dry mouth problems. She was
Mm,
seeing problems with aging skin. And so we came up with a line of products basically to be natural based and would improve, uh, quality of life, focusing on the skin and mucous membranes. So that's kind of how our
yeah.
first product was that we did was for a dry mouth product based on yerba
Mm-hmm.
santa plant, which is very fascinating because I had had a patient with a cancer of larynx treated with irradiation, and he couldn't get relief with his severe dry mouth. And he happened to be a PhD food chemist
Mm,
uh, who worked for many, many years at Del Monte Foods. And so he remembered he was a little boy growing up in Northern California. His mother used to make an herb tea out of yerba santa for things like colds and sore throats and things like that. So he
yeah.
made up a tea for himself, and he got dramatic improvement. And then he started chewing on the leaves, and he got really a lot of improvement. So he came up with this concoction with the yerba santa and in a frozen lemon lime concoction. And he brought it into me one day, and he said, "Here, try this." And I said, "Well, I got to be killing myself in
Mm-hmm.
this business one of these days." So, and anyway, the story was so fascinating. It took a couple of years to develop the product, and he was our focus group of one person. Unlike big companies which have nice big focus groups,
Yes.
we had this one guy who was about 76 years old at the time. And so when he said, "That's it," that became mouth coat. And so we then did clinical studies at the University of Minnesota, a xerostomia clinic. A very prominent dentist there runs it. And we found out that our mouth
Yes.
coat was more effective, lasted longer, tasted better than anything else on the market for dry mouth. So we focused then on the cancer market for the people, the post radiation, post chemotherapy patients, post op patients, of head and neck surgery,
Yes.
particularly, as well as some of the conditions like Sjogren's syndrome or some autoimmune
Mm-hmm.
diseases. And we
Yes.
gradually got the product going. And then we did some nasal and sinus products based on a formulation called Dr. Pretz was an old ENT doctor, German,
Yes.
who was in St. Louis. And so he had come up with a formulation for nasal spray that was effective because he published a book and showed why saline was far better than just with if you add glycerin to it, for instance, than just salt water alone. So
Yes.
yeah, we formulated our product based on his formulation and then also with the yerba santa. So gradually we got those products out there. And then we also did a line of skin renewal products for things like brown spots and wrinkles and so on. And we
Yes.
did a vaginal moisturizer called Feminese because
Yeah.
many people now who were had been taken off all the estrogens had a lot of
Mm-hmm.
trouble with postmenopausal dryness. So those are our
Yeah.
initial products that we did for a number of years and finally got pretty good distribution of them. And in 1999, we went to Ireland and opened an office there and started making products there. And we have a distributor, a big cancer company in Germany that does the dry mouth
Oh.
product under the name of Saliva Natura. And they go to Germany,
Mm-hmm.
Poland, Hungary, Czech Republic, all those countries. So that's kind of a long
Yeah.
story short, basically, of how it evolved.
Dr. Parnell, I want to just touch back on the dry mouth syndrome. Now, for people not familiar with that, it's quite a big problem across a whole range of things. So, if you're having radiation, you'll get it then. Certain medication will cause you to have dry mouth. What is it that drives the need for something to relieve that dried mouth? I've had it myself. Understand how uncomfortable and horrible it is. But can you tell the audience about the size of that sort of problem? That's a large cohort of people, isn't it?
Yes. In fact, what's interesting about it is when we started this in 1986, it was like missionary work. We'd go to
Yes.
medical trade shows and have to explain why dry mouth was a problem. And
Mm,
doctors and dentists and so on would say, oh, it's not a problem. If patients have a dry mouth, we just have them take sips of water or eat hard candy. And of course, the more hard candy you got, the more cavities you got
yes.
to go to the dentist. Well, anyway, that was kind of like missionary work. Now what's happened is it's gotten to the point where everybody has dry mouth because with the aging population, particularly, and the use
Yes.
of all the medications, there's like right now, there's about 400 or more known medications that cause significant
Yes.
dry mouth, whether it's antihypertensives, decongestants, you can
Mm-hmm.
go through a whole category of drugs that all have a side effect. And when you see them advertised, you always hear side effects: dry mouth, dry mouth, dry mouth.
Yes.
So what happened was, then it got to the point where it got to be well known. Now is at the point
Mm.
where I can say this, that the biggest single problem causing a dry mouth now is polypharmacy. Polypharmacy is basically everyone
Ah,
is taking 4 or more medications will have a dry mouth, and that's because
yeah.
they're very basic. It's just a side effect of all these medications, as well as
Yeah.
aging process. So what's happened is now we don't have to even talk about it because dentists, particularly and
Good.
hygienists, will say that's the biggest problem we see in our office because people coming in
Mm.
who used to have a pristine mouth are coming in with many cavities, as they get older. And so as a result, it's kind of now it's become very, very well recognized and a significant cause of dental disease and periodontal disease.
Yes. And it's not pleasant. When your mouth is continuously dry, it feels horrible, and it's always present in your mind, and it's like, oh, I need to drink of water. I need to, it's quite compelling when that is how you go through your day-to-day life. The other element around dry mouth is for those people who are under radiation, as your first patient was. The radiation causes the mucous membranes to dry out substantially, particularly those in the mouth. And was it a kind of a chance discovery that he found out that this worked? Or was it a conversation that started you on that path, that he said, try this, and you realized that it was worked quite well?
But when he told us this story, it was kind of interesting. So nobody had ever
Yeah.
done too much with it in modern days, but going back, we found out, for instance, that it was used by the Native Americans very frequently in a tea. And in fact, they
Yeah.
used to smoke it. They used to smoke Yerba Santa for asthma, believe it or not. And they also would use
Oh.
it. They would use it for various conditions like bladder infections and all kinds of things. And then in modern
Mm-hmm.
day, no one had ever used it other than the fact that it was very interesting. We found out in the early 1900s, one of the biggest pharmaceutical companies was using it extensively to mask the taste of bad tasting medicine, like quinine, when quinine was
Oh.
used for
Yes, yes.
malaria. So
Yes.
then it stopped being used. When we came upon it, the only uses were in probably some tobacco products. It was always proprietary, but I suspect that was being used in some of the chewing tobaccos, things like that. But nobody had ever heard of it. So when you look in a lot of herbal books, you will see all kinds of herbs, of course, but very rarely do you ever see anything about yerba santa. And but that's kind of how it evolved. And so we took it upon ourselves to isolate the key ingredients and do the chemistry of the yerba santa. And that's when we found out what it was consisted of, which was the mucopolysaccharides, which make it like a super moisturizer, a very mucinous type of substance, and the glycoproteins and the antioxidants. And so there was more to it than met the eye in terms of how it evolved, you know. But that's kind of was the basis for 6 patents that we have, because ironically, it had already been grandfathered in by the Food and Drug Administration as a flavor. So it was used going back all these years. And when FDA started in 1939, it was grandfathered in as a flavor. So we didn't have to do anything with it other than we ultimately did have to register it as a class 1 medical device, because once we made the claim for dry mouth, that became, since it's not a drug, originally it was considered a cosmetic. It's still considered a cosmetic in some places, cosmetic moisturizer. So it's like a skin cream, you know, for dry skin. However, in Europe and the US, it's considered a medical device. And that's kind of how it's evolved. Yeah.
The plant itself, can you tell us a little bit more about it? It's the leaves that you predominantly use, or is it all of the plant, or how does that process work? How do you get the components that work from the plant itself?
It's just basically an extraction process. And then we get the components of it, and then we add varying amounts of it. And so we get the same degree of lubricity from a very low concentration as you would get using like 90% aloe vera. Now, many people are very familiar with aloe. So if you have a product with aloe, for instance, you have to have a very high concentration, like 99% or very high. We found out that our degree of moisturization and lubricity with the yerba santa, we use very low concentrations actually. And of course, as I said, it's safe. It's a flavor. It's got a kind of a distinctive flavor, but it's not bad tasting at all. And so, in addition, we put in our mouth coat products, we put in the xylitol. Xylitol was something that was used as an alternative to sucrose. So we initially couldn't put sucrose in the product, which is sugar, because that causes dental decay for all the irradiated patients. So we never could have the patients who are getting X-ray to be using sugar. Well, it turned out that the Finns found out about xylitol, and xylitol is derived from birch trees. And so we initially were getting from birch trees in Finland, and it was like liquid gold. And now it's more common. Actually, our xylitol comes from the Midwest, derived from corn. And xylitol was documented by the Finns to reduce infection that causes dental decay. So finally, it took a long time, but FDA finally started allowing a claim that it prevents dental cavities. And that's why you'll see it in some chewing gums and so on. But you have to use a certain concentration or above. If you just put a token amount in, it's not going to do anything.
Yeah. Dr. Parnell, your medical background is in head, nose, throat. Your wife's specialist dermatologist, is that correct?
Yes. She's been practicing over 50 years.
Yes, that's exactly right. So the combination of your wife's wisdom, knowledge, and understanding, and yours is a pretty powerful one from which to create a pharmaceutical company that focuses on our mucous membranes and skin integrity. That should be kudos enough to know that these products are really amazing. I just wanted to quickly talk about your what's happening with that one. Tell us all about it.
The new products? Well, what happened was about a year and a half ago, for one of the products, the first thing that happened to us was our distributor in Germany just goes to the cancer market, cancer hospitals, and oncologists. Unknown to them and to us, dentists at the University of Berlin Dental School found out that ours was the only product for dry mouth in Europe that did not cause dental erosion of the enamel.
Cavities.
So, the erosion of the enamel, particularly, is because of the nature of the product. So this young dental researcher did some studies, and he found out that if you developed a product, they said, if our product does not demineralize, what do we do to remineralize? So he came up with a ratio of calcium and phosphate. And if you go above the ratio, it doesn't work. If you go below it, it doesn't work. And it took us 2 years to develop that product, which we made initially in Switzerland. And we did studies on that, which also showed how he had published extensively in the German literature and in England, and got an International Research Award. He was the first German dentist to ever get it. So then it took us a couple of years to launch it, and we put it in a very large size bottle, which you cannot sell in Europe. It was a 500 ml size. So we finally brought it back to the US. And so that's our product called Mouth Coat Remin. And now, as an extension to that story, about a year and a half ago, came across a product that was developed at New Mexico Tech, which was this whole story about the Michael Delens and the antiviral, antimicrobial resistant pathogens. So what happened then was we licensed in this compound that had been developed there for antibacterial use and antifungal use. And they had done extensive testing and showed that it was really effective in vitro against the antimicrobial resistant pathogens, including everything from MRSA to Pseudomonas to various other, most of the bacteria on the World Health Organization list of drug-resistant pathogens, actually, as well as the CDC in the US. So then we were ready to move ahead with the product for MRSA, because MRSA is so common, and the only one drug approved in the US, it develops resistance with prolonged use. Up to about 60% of the time, it'll be resistant. So we knew that studies showed that our product is not. So taking this compound and combining it with our existing products, we found that it was really effective and destroyed all these pathogens. So then we were ready to go to FDA. We were ready to go to FDA with it against some of these pathogens, just when the pandemic hit, and of course everything shut down. And so we had to stop in our tracks. And so I thought, well, let's see if it might work against the SARS-CoV-2 virus. So that's kind of how the rest of the story evolved, was with those products, because we did the testing. We found out that in an outside independent laboratory that our products were greater than 99.97% effective in destroying the live virus. And so since the main entrance to the virus is in the nose and somewhat in the throat, that was just exactly what we were doing. So all we did was add it to our existing product. And that became our Nomovid. We started calling it, we have the Mouth Coat MD, and we have a body wipe, facing a body wipe. So, this is kind of how it's all evolved in terms of the basic formulations that we have and the products that we have. So we've developed those products, and I recently launched them as an antiseptic type of product. and it's basically a
Yes.
nasal spray with the mycodolens. Now, what's interesting, the rest of that story is just like the yerba Santa story. The mycodolens compound, which is a hybrid compound, consists of ingredients that are all approved in Europe and the US, and they're used in many, many hundreds of cosmetic products safely. So the degree of toxicity, or the fact that they're safe, is well documented because they've been used for many, many years. And so that's kind of how it evolved, developing those products. And now, with everybody traveling so much and everything, it's very easy to just use a couple of squirts of the nasal spray, whether you've been vaccinated or not, you know. And for all those people that are not vaccinated, it's obviously, we like to think that it helps prevent the infection, and it reduces the viral load.
How exciting was it when you discovered that it had the capacity, the 99% efficacy against the coronavirus? How exciting was that for you and the team?
Oh, it was very exciting. What happened was it took us, actually, from the time we decided to try it, to get an outside independent laboratory, it took 2 months to find a lab. It's another 2 months to wait in line, you know, behind everybody else and their brother trying to get tested. And then another 2 months to get the results. And so that was 6 months. So by about August of last year, 2020, we finally got the product and documented the in vitro efficacy of it. And then we just had done it. Then we did additional testing with the product in our existing products to document the same degree of effectiveness. And that's when we started putting up some of the product. And what we did was we applied the Operation Warp Speed for grant money. Now, as you know, that they were spending hundreds of billions of dollars for vaccines and with a number of companies. And of course, ours is a therapeutic. But what we didn't know was, even though they had a therapeutic section, and to this day, there's only one therapeutic product that's ever been approved in the U.S., which is remdesivir, but it took a long time. And there still is no vaccine formally approved for use in the U.S. It's all emergency use. So we were under review for many months, let's put it that way, while millions and billions of dollars were going to vaccines. Now, the truth of the matter is, it's very exciting that it did because it worked. There's no question that people should be getting vaccinated, and it was fantastic and exciting from that point of view. From our point of view, I guess you have to say it was a little bit disappointing because of the fact that we got, we got to the back of the bus. And so at this point in time, there's no such thing as Operation Warp Speed anymore because Warp Speed has already done its job of developing all the vaccines, you know? So we're kind of, but at this point, as I said, we really licensed it from New Mexico Tech University for the antibacterial and antifungal uses. And so now we can back up and get started again where we were a year ago, February. But that's kind of how it's evolved. You know, it's a strange story, but it's you know, that's kind of how things go.
Yeah. Now, this nasal spray that has against the virus, for those people who are not familiar with nasal sprays, it's 1 or 2 puffs in each nostril, and how long does that protect them? So how long before they have to do another puff?
Well, we recommend 2 or 3 times a day. Now, you know, if you're not going out at night and you're home and it's safe and everything, you don't need to be using it 3 times a day. Unless you want the moisturizing properties, because as I said, this is the same formulation is in a saline-based nasal spray, which is 3% glycerin, normal saline, and then it's got these the mycodolens. So it works to moisturize as well. But let's say if you're going out shopping and you're going to be on an airplane or whatever you're going to be doing out and about, it's as
Mm-hmm.
helpful to just a couple of squirts each nostril twice a day, you know. But if you're
Yeah.
going to be at home at night, if you're going out at night, I'd use it before I go out too. But I think usually about three
Yeah.
times a day.
Yeah. Yeah. So for people wanting to buy this product from you, it's available directly from the website, isn't it? Is it available in over the counter as well?
No, we don't have it in any retail stores right now, and we don't have
Mm-hmm.
it in any of the big wholesalers like we have our other products, the mouth
The
coat and
others?
the Pretz, because it took us 10 years, for
Yes.
instance, as a small company just to get the mouth
Yes.
coat into the traditional big wholesalers. And so
Yeah.
you have to really have high degree of success with the product for them to bring it in. And in order to get it on
Yes.
the shelf, now in Canada, for instance, the dry mouth product is on the shelf in some of the major pharmacies. In the case of
Mm-hmm.
Europe, in Ireland, for instance, where we distribute the product and make the product, we have it in many of the pharmacies there. And then, of course, as
Mm-hmm.
I mentioned, in Germany and those countries, it's only limited to use in the hospitals and by the
Yes.
oncology community, but it's a big,
Yeah.
so it varies depending on each product, but
Yes.
everybody can get it right
And
on
it
the
takes,
website. Yeah. Hmm.
I was just going to say, it's accessible for everyone if they go to the website, which is Parnell Pharmaceuticals.com. And that link will be not only on our websites, but also in the chat box if you're listening live. I just wanted to quickly touch on this is not an alternative to getting a COVID vaccine. This is just an additional protective measure for those who want to really increase their chances of not contracting the virus. That's true, isn't it?
Yes. So the great thing is with there's basically two groups of people now: is the vaccinated, which
Yes.
I hope most people do get the vaccinations. Many people who are not getting the vaccinations uh, should be using it, uh, honestly,
Mm-hmm.
because I think that way at least they can help do something that's pretty simple and inexpensive to do
Mm.
with an over-the-counter nasal spray. If you can cut your nasal viral load substantially,
Yes.
because that's where all the severe infections are originating, and we know that
Mm.
it's killing the virus. So hopefully you reduce the viral load. Uh, even if you've had the vaccine though, and you're flying, for instance,
Yes.
uh, it's always good
Mhm.
to use a nasal spray because it's so drying. Airplanes are so drying anyway.
They
So you
are.
need the moisturization, you need the lubrication, and then also to have the added benefit. Now, just like you'd say, you'd have a little kit with a wipe and you use a nasal spray, say if you're going on the plane. So you can have it in a little
Yeah.
kit type of thing, and
Mhm.
it's easy to carry, and wherever you're
Yes.
going out and about. So use it in conjunction with the vaccine as well. Mhm.
Mm. Dr. Parnell, in terms of our mucosal surfaces, so those soft, moist surfaces inside our mouth and down the back of our nasal passage rather, and down into the back of our throat. Um, can you explain to the audience what happens if we allow them to become drier or less lubricated than they would normally be, say for, if we're flying? What happens? That process of drying does something that allows bacteria to get in more readily, doesn't it?
Yes, because this normally saliva, of course, from the salivary glands and all the mucus from the mucus glands
Mm,
have a protective function. And what they do
they do.
basically is lubricate, and they do have some enzymatic properties where it does protect. And what happens with the
Hmm.
extreme dryness is then it leaves the surfaces bare, and you get these little cracks or areas where you can have infection. a good example of this, of course, is with the effect of severe dry mouth causing
Yes.
dental cavities. That's the best example, because somebody that has severe dry mouth will likely end up to the point. I have slides that I show in my presentations of some mouths of people who have had long-standing dry mouth. And when you take a look at their teeth, you can see what the end results of dry mouth can be. And they're just terribly, they're just about ready for total extraction, basically. And so that's that's the end result of it. But what people don't realize too is that a lot of people have mucus glands in the back of the throat and in their hypopharynx down near their larynx. Over the years, we've had many professional singers, rock stars, leading people who use their voice a lot, that they've always used mouth coat. And we find out that certain people will have even their pictures in magazines, a lot of celebrities that we know about. We don't talk about them because they do have their pictures sometimes taken in the magazine while they're using mouth coat, for instance. And but we have a number of over the years, people are Broadway singers, for instance, and singers. They'll use it, and of course, it's not because it goes through the vocal cords. It does anything to the vocal cords, but it affects all the mucus glands and the hypopharynx and the back of the throat. So that's why it's very important to have a certain degree of mucus protection.
Yeah. I'm not sure that everyone in the audience realizes just how protective our own saliva is, and an absence of that saliva takes away the protection it affords our mouth and nasal passages and the back of our throat. And that's why it's important to talk about dry mouth and the impacts that it can have. And these products that Dr. Parnell has worked on all these years are particularly important in protecting your mouth from dental cavities and protecting your nasal passages from that dry syndrome that allows we're not just talking about COVID, but this is about the other viruses that you can open yourself up to if you lose that protection by virtue of having a dry mouth or a dry pharynx. It also works the same way with your skin, doesn't it? If your skin loses its moisture, it forms cracks and allows viruses or bacteria to get in there and cause problems, doesn't it?
Yes, yeah. So the skin has a little bit, an extra layer of a covering of the epidermis that's a little bit more protective, obviously, than the mucous membrane. But the tissue itself is, pretty much the same, and it acts the same way. And this is why people, really do need to use. This is why there's so many companies, cosmetic companies out there, that is, a huge multi-billion-dollar market for big companies, because people want something that's effective, that does something, whether it's for the dry skin or for the wrinkles or whatever. It's not just to cover up the skin.
Yeah. With your products, Dr. Parnell, you've done some extensive research and testing of your products. And I want to make the point too that none of your products are tested on animals, and they are predominantly natural-based products, aren't they?
Yes, they are. We don't do any animal testing, and it's all natural, based on the yerba santa, as I mentioned before.
Yeah.
And for instance, and the other
I
thing,
wanted to talk to you. Yeah, you go. Sorry.
No, go ahead.
I was really curious to know, of all the things you've done in your long history in your specialty, is the pharmaceutical a company part of what you're passionate about?
It certainly has developed that way. You know, I love practicing and I love doing surgery and love medicine and you know, once I started doing this, it was what I had been doing when I was at Becton Dickinson. In a sense, I was one of my functions was to go out and do technology transfers, looking at things that were being done in the universities and get them licensed in or to acquire companies, for instance. And these are the things I really enjoyed as I found out. And so what I didn't like about working in a big corporation was working in a big corporation after a certain number of years. And so that's and all the traveling and stuff that I was doing. So that's when I decided that, you know, I missed practice. It was time to come back, you know, and practice and walked away from it. But I didn't walk away from it totally, because when I came back, I was one of the few people who had been involved in the early days of the regulation of medical devices and knew how to get these products to the market. So when I came back to practice, actually, I was spending an awful lot of time consulting with big companies and small companies, getting their products on the market and getting them approved through FDA. And so one day, one of the venture capital companies said, "Hey, why don't you start your own company?" And I said, "Well, you got to be crazy. You got to be crazy to start a pharmaceutical company in this day and age, you know." So what did I do? I turned around and did it, you know. So I don't know. I guess you have to say it's a passion. It's a passion, but not a hobby, you know.
Yes, yes, yes. You must have seen some phenomenal technology evolving in the medical healthcare arena. What's been some of the exciting things that you've seen over the course of your career?
Wow. Some of the things I was involved in, actually, and having deeply involved with were a device called the FACS cell sorter. It was developed by BD at the research center in Research Triangle Park. And it was a true device in search of a use. And it was two of them in use, one at Rockefeller Institute and one in Germany, Max Planck Institute. And it was really a device in search of a use. Nobody knew it. They thought maybe it'd be good for cancer, something like that. Well, ultimately, when HIV/AIDS came about, guess what was the primary device used to separate out the T cells? It was a cell sorter, which nobody had a function for. Now it's just routine, because all these things that are being done with these various cells depend on separating out all these cells. And that's what this device did. That's one example. Another product was I was trying to get licensed in was the electrical stimulation of bone. And there's a tendency in big companies not to bring in things that are in little black boxes, because they're afraid there might be a mouse running around inside the box, you know? So I came across a device. A very prominent orthopedic surgeon at Columbia University came up with this device. And you put it on these non-union of fractures when because sometimes fractures don't heal. And it's a very severe problem, and some people end up with amputations. Well, he found out if you take these plates or you put wires in and you put a certain degree of electrical stimulation, they heal. And when you start looking at x-rays and you see how fantastic this is, well, ultimately, BD did not buy the company. However, he went out and started his own company. And that became a public company ultimately. Then you get into the skincare products and with all the topicals. And so that's kind of what some of the things that I've seen, over the years. And then we've developed products ourselves. We got a new drug approved for psoriasis in 1987. We were one of only 21 new drugs approved through FDA. And that was because
Yes.
if you inject a little bit of it, everybody was depending on ointments for all these
Yes.
psoriasis problems. Well, you could inject a
Mm-hmm.
little bit of this into the skin, and it would just go away really quickly. So we got that product approved, and we licensed that off to a major company. So there's been
Yes.
things that have evolved, that you just kind of you keep looking. In other words, and you kind of
Yes. Yes.
think about what's needed, and that's kind of how it all started. Was because we just couldn't find products that were quality of
Yes.
life products that our patients needed. That's all, and we just said, okay, we need this because of this such and such problem, and then we try to keep it as
Yeah.
simple as possible because none of our products are super complicated.
Yeah. I'm not sure if the audience understands that you might find a fabulous product, but the process of getting it to the end user is hugely takes a long time, is quite complicated. So the product might be nice and simple, but the process of getting it through all those approvals and to market can be quite complex, and it takes a long time, doesn't it?
Well, the regulatory process is just enormous. It's just very difficult. Uh, I think that it's the cost of entry. This is why you see drug costs so high. It's not because
Yes.
they should be that high, but it's because what's had to go into them and the money and the losses that have occurred just going through the process, the whole research
Yes.
and development of the product. In
Yes.
addition to that, in addition to that, that being successful, you still have this regulatory mass amount of hoops to go through,
Jump
and
through.
you jump
Mhm.
through all these hoops, and to the point where there's things that are taken off the market because the hoops have gotten too regulated, and it's become,
Yes.
it's just
Mm.
not economically not feasible, and so it's
Yeah,
it's it's largely very frustrating from that point of view. And
I'll bet.
it's more than a challenge. Some days you think, what am I dealing with this for? But you just kind of keep going.
Yeah, yeah. Because at the base of that is that desire to solve a problem for humanity, something that helps them lead a better life, helps them live longer, helps them be healthier, be happier. All of those things sit behind some of the development of new products. I'm wondering, in what do you see in the future for you and Parnell Pharmaceuticals? I'm guessing that you've got children and grandchildren to follow on with your passion, yes?
Our son John has been president of the company for several years now. He came with us right when he graduated from college,
Yes.
and
Mm.
so he basically runs a lot of the day-to-day operations of it. Uh, what we Our biggest need going from all along the whole story is, since we basically bootstrapped the company and funded it all ourselves, we elected
Yes.
not to take venture capital money anywhere along the way. However,
Yeah.
what you do learn is it's so capital intensive that, for instance, right now we'd be
Yes.
very happy to license off the Michael Delen's products to a major company
Yeah.
who
Yeah.
had the financial depth and the marketing depth to really get
To,
it to more people. And so that's really what
yeah.
long range, that's what our goal really is. But it's very
Yes.
difficult because people are not too willing and able to take the risk, just because of the
Yeah.
regulatory issues more than anything. And so
Yes.
we keep,
Yeah.
talking to people. We talk to everybody that would like. In some cases, we have many distribution agreements with countries, and for
Yeah.
instance, Canada. I mentioned Germany, and we have in
Mm.
Switzerland, different countries. Uh,
Yeah.
but as a result, we just keep going, and hopefully we'll find somebody who's really a fantastic joint venture partner or a licensee
Yes.
who would like to
Yeah.
develop and market the products, which is to get it in more hands of people that it can really
Yeah.
benefit. And so that's what our goal
Mm.
is. But, that we just have to go along and take one day at a time.
Yeah, yeah, it's a long and difficult road when you're trying to get particularly medical products. I mean, it's good that medical products and pharmaceuticals are regulated and licensed to such an extent. But when you've got amazing products, the process is long and tedious, and I guess it feels like never ending.
And that's a good way to put it. It seems like it's never ending. That's right.
Absolutely. Just quickly before we run out of time, for anyone listening today, these products that Dr. Parnell's been talking about are specifically mouth, throat, nose products, and they're available on Parnell Pharmaceuticals website for purchase directly. You can purchase them from anywhere like anyone around the world can purchase these products. Yeah?
Yes. We can ship from here, or in many countries we ship from our office in Dublin. It depends where it
Yeah.
goes, but we can generally ship out
Yeah.
from anywhere. Mm-hmm.
Yeah.
And
I'm
we
curious
have a 800
why.
line too. Go ahead. I'm sorry.
Yes. I'm actually, I meant to ask you before. I'm curious why Dublin? Why Ireland was one of the places where you decided to have an office? Is there a reason or rationale around that?
Well, I had a distant relative, Charles Stewart Parnell, who's considered the uncrowned king of Ireland, and got the independence from England, and was a member of the parliament and had his political party. So I have a very 100% Irish background. That was a good reason. But another good reason was I
Awesome.
knew.
Yeah.
But there was even another reason. The other reason was I knew if we could get our products approved in one country, in the EU,
Yes.
they'd be approved in all the
Yes.
countries in the EU. So I found if I
Ah.
went into Ireland, where I was able to get a good contract manufacturer, because we've always had contract
Yes.
manufacturers, and we identified somebody who was good, and then we could get the approval in Ireland, then it would be good for all of the EU. And so basically there were two reasons for it.
Yeah.
And we love it there anyway. So I go there about
Fabulous reasons.
five times
I
a year
was
until the
just gonna
last
say,
year,
isn't that
which
a
I'm just
I was
itching to
just
get
gonna
back.
say.
Yeah, yeah. There's a lot of there's a lot of Irish in
Yeah, I was
Australia
just gonna
too.
say.
But yeah.
Yeah.
But it's
Yes, I've got
my
Irish.
family used to tell me,
There's Irish in my
all the
background as
Irish
well.
in Aus, well, all the Irish, they went there. In fact, my mother's name is Lawler, Lalor, and there's a bunch of Lawlers in Australia. One of the
Yes, yes,
guys was in Parliament there. But so they kind of
yes.
so I get along well when I go to Australia too, because some of the people know the name.
Yeah. Yes, yes, yes. Dr. Parnell, we are just about at the end of the program. Thank you so much. It's just a divine pleasure to get to speak to someone from my old healthcare realm and to talk about products that really have been developed to help people. Don't forget, people, if you're listening live today, jump onto Parnell Pharmaceuticals. I've also got the links to Parnell Pharmaceuticals on Facebook, LinkedIn, Instagram, and the website is parnellpharm.com. And the products that Dr. Parnell's talked about on the show today are all available across the world for purchase. And as he suggested earlier, even though we're vaccinated, an additional layer of protective will not hurt. And these products have been researched, and it's wonderful to know that they can knock off those little viruses before they can do any damage. Francis, thank you so much for being on the show today. You can catch up on the replays on binge networks across the US and on all smart TVs across the world. Dr. Parnell, thank you so much for your time today.
Thank you for having me. It's been a really pleasure. Thank you.
An absolute pleasure to talk to you. That, my friends, is our lot for this week, and we will be back next week with another show. This is your host, Toni Lontes. Bye for now.